Look at this beauty. So what has been going on in my life these days? Honestly, not much. I've just been studying for hours on end. I have a couple of big licensing board exams coming up, so that has been adding a lot of stress in my life. I'm managing. Am I managing? I don't know. It has been so dry lately. I am trying to become more consistent with my skincare as well as my water intake, just because I have been waking up feeling super dehydrated. I actually got a facial last week and even my esthetician could see it on my face and pointed out that my water intake was lacking. So I definitely need to step up on that. And then I have my humidifier over here in the corner just because it tends to get really dry out here. My days have become quite redundant. I usually try to sneak a workout in the morning, but since I have been staying up so late until like 11:30 or midnight, it's been really hard for me to make my early morning workouts. So if I get out of clinic early, then I'll go in the evening, but if not, sometimes I just forego my workout. I must say that life recently has just been really stressful. My everyday looks a little something like this. Wake up, clinic from 8 to 5. I'll study during my lunch hour just to make the most out of my time. And then I come home, eat dinner, rest for maybe about an hour, and then I'll study from 6 to 11:30, maybe 12. Are all 5 of those hours actually active, extremely effective studying? No, probably not, because I'm pooped from the day. But you know, I just try to do my best out here. And your girl is tired. Tired, stressed, maybe a little depressed. Anyways, I thought that I would dedicate this vlog to showing how I kind of de-stress and try to take care of myself. Just because I think that stress management is an extremely important skill to master at all stages of life, but especially in grad school, specifically medical school, dental school, pharmacy school, etc. It's tough. So props to everyone out there in school killing it. We got this. Now is my time to just watch a little show to wind down for the night. I'm currently watching Love Life on HBO Max, and it's very lighthearted and relatable. I actually have a little theater set up in my room now. As you can see, I have this projector here. It's dangerous because now I never have to leave my room to watch TV. This was a much cheaper investment than getting a TV in my room, and I just have it projected onto my wall, and I got my speaker Bluetooth set up, so yeah. I am officially tapping out of studying for the day. I've gone through quite a number of practice problems, so I actually feel pretty confident, and yeah. One of my goals for this year was actually to take better care of my appearance, just in terms of how I present myself, especially in a professional setting. And I feel like as a provider, it is important to kind of present yourself in a certain way so that patients will take you seriously, just like how you're not going to show up to an interview wearing pajamas. So for me, part of that involves doing makeup in the mornings. Nothing too crazy because you know, I still want to be professional. A while back, a couple of friends were talking about extensions, and in our mask wearing days, this is all you really see. But extensions are so expensive. They're like anywhere from $100 to $200, and then for fills they can be like $60 to $80 depending on how often you go, and that's not an expense that I could really fit into my budget. So my alternative is this. These are lash clusters from Amazon. I found a girl on TikTok who talks about doing her own extensions. I actually prefer this method just because I have control over when I can put them on and take them off, and then it's cheap and simple. I invested in a good lash bond. This is from Lashify. This is definitely on the pricier side, but you want like the good quality stuff. And then in terms of the clusters, I think these were like $11 on Amazon, and they last me for about a month and a half. Depending on how well you take care of them, you can actually reuse them. I keep them this looks so gross. I actually keep them in this container. I have it soaking in eye makeup remover, and then after it's been soaking for a while, I switch it out for alcohol, let that soak for a while, and then I like sit there and then dry off all of the individual lashes so that I can reuse them again. I just have my little mirror right here. So the lash map that I use is 16, 16, 14, 14, 14, 14, 12, 12. It's very simple. So this is lash bond. You could think of it like a more permanent lash glue, and this can last anywhere between 3 to 7 days, but I just like that I can take them off when I want. So now that I have like a very light coat on my lash, I just do one at a time. I'm gonna go in with the 16 little cluster. The first one's on. Okay, and then that's it. So you can see, huge difference, and I feel like it significantly decreases the amount of time it takes for me to get ready in the morning, just because I wake up, have these lashes, bam. And then I kind of just squeeze, squeeze, squeeze. They don't go on your lash line, they go like a millimeter away from the lash line, so on your actual lash. And then I bought like a whole thing of these makeup spoolie brushes, so you could kind of brush it out. And there you have it. Yeah, a much cheaper and quicker alternative to lash extensions if you want something to just give you that extra oomph. Now that we have that done, now I'm gonna do my nails. I am a sucker for long nails, but unfortunately it is not the most ideal for working in someone's mouth. I'm gonna keep them short, but I am gonna do a little simple design or something. Let's do my nails. First things first is UV protection. Because it is gel, this is somewhat extra, but oftentimes your hands are the first to show signs of aging. This is another reason why I like to kind of do things at home, is because I have control over how things are done, because typically when I do get manicures, there's a lot of nail prep that goes into it, and I feel like oftentimes it makes my nails really, really thin and brittle, which I do not like, and it makes it very sensitive. Also, they use like some next level gray type of UV. I usually don't wear sunscreen to the nail salon, so since I'm at home, I can kind of do all that. And then I also have my own UV gloves for that extra protection. This is also highly extra, but I have an air purifier in my room and I don't want to be inhaling toxic fumes. So I'm going to turn that on, turn my window on, make sure it's well ventilated in here, because we are all about safety. And here are the final results. Super cute. Okay, and now it is time to make some dinner and then end the night off with my shows. test day today. Wanted to show you my quick little breakfast before I head out in about 30 minutes, but this is oatmeal. I've been having this every day for the past month since I kind of came up with this recipe. Super fast and easy. It's literally just oatmeal, water, and eggs. And then I just top it with some sesame oil, sesame seeds, furikake, and then you put it in the microwave for about 1:30 to 2 minutes. There you have it. For as long as I can remember, I have always struggled with test anxiety, and I would say that I probably struggled with it the most in college. I remember my test anxiety was so bad the night before my DAT that I got maybe like 1 hour of sleep. Since then, it's kind of just been a battle of learning how to overcome that test anxiety. Last night I actually slept pretty well, probably because I worked out, and I also took a melatonin just because I've been having pretty poor quality of sleep in the past couple of weeks. I woke up this morning, did a little meditation with some affirmations, and I feel like that's kind of been helping train my mind to self-soothe and realize that I have the power to create the life that I want and that I choose, and everything else that is out of my control, I need to just let go. My test is at 8 a.m. but I want to get there around 7:30. So I still have about an hour. So I think I might quickly look over some notes that I have. These are the past maybe 5-ish weeks of studying combined. I have a condensed outline, so I might just briefly look over that, but I didn't study at all yesterday since my study plan told me to take the day off, so I did. I'm pretty excited to get this exam out of the way so I can start studying for my other big exams coming up at the end of April and the beginning of May. So once those are over, the stress of exams will be over, but that's when I start rotations, and that's also when I'll start my applications for residency. So exciting things. I got the whole day off today, so I am just going to spend the rest of my day decompressing. Probably head to the gym in about an hour and a half. Lately I've been reading this book called Attached, and it is honestly mind-blowing to me. I think it is really helping me learn a lot about the way I am, how I function in relationships, and it makes me feel very validated in my experiences and is kind of giving me a really concrete idea of what it is that I want for myself in my future relationships. So just thought I would share. The reality of dentistry is that you will probably break your body or have a lot of pain in school and throughout your career. So it is very important to take care of your body and stay active, but also give it the rest that it needs. With that being said, I'm not sure if it's because I slept wrong, had a long day in clinic, or I was working out too hard, but my lower back has been hurting a lot. And I was talking to my esthetician. She had suggested doing Epsom salt soaks. So I picked some up. I thought I would just soak myself in the tub. It's supposed to draw the toxins out of your muscles or something, but not sure what the scientific reasoning is behind Epsom salts, but I thought it would be nice for my body to just sit in some hot water and just relax my muscles. So that's what I'm gonna do. The instructions say to add 2 cups. Put it in here.